How to assess an ear problem, checking for malnutrition and anemia. Ear infection rarely cause death, but they are the main cause of deafness in developing countries. An infection can spread from the ear to the brain, causing meningitis. To assess for an ear problem, first ask the main symptom question. Does a child has an ear problem? If there is an ear problem, assess the child further. Ask, is there ear pain? Is there ear discharge? If yes, for how long? Ear discharge is a sign of infection. The duration of ear discharge is important when deciding whether to treat the child for acute or chronic ear infection. Next, look for post-training from ear. Look closely into each of child's ears. Feel for tenderness swelling behind the ear. You should feel behind both ears like this to determine if there is a tender swelling of the mastoid bone. The mastoid bone is the large bone behind the ear. Tender swelling behind the ear may indicate a deep infection of the mastoid bone. Both tenderness and swelling must be present to classify mastoiditis. The health worker would classify the ear problem, then check for signs of malnutrition and anemia. It is very important to check all sick children for signs suggesting malnutrition and anemia. Next, look for visible severe wasting. To look for visible severe wasting, remove the child's clothes. Look for severe wasting of the muscles of the shoulders, arms, buttocks, and legs. The hips look small compared to the chest and abdomen. Look at the child from the side to see if the fat buttocks is missing. The child with visible severe wasting may still have a normal appearing face in a large or distended abdomen. This child has visible severe wasting. A child has visible severe wasting has marasmus, a form of severe malnutrition. Next, look for palmar pallor. It is an unusual paleness of the skin and it is a sign of anemia. Children with severe palmar pallor have severe anemia. To see if the child has palmar pallor, look at the skin of the child's palm. Hold the palm open by crossing it gently from the side. Do not stretch the fingers backwards. Stretching the fingers backwards may actually cause pallor by blocking the blood supply. Compare the color of the child's palm with your own palm or with the palms of other children. This child has severe palmar pallor. Palm is so pale that it looks white. This child has severe anemia. If the child's palm is pale but not white, the child has some palmar pallor. The child's palm is normal if it is a healthy pink color. Anemia occurs in children who are not eating foods rich in iron or who have malaria, hookworm, or whipworm. Severe anemia can be life-threatening. Next, look for edema of both feet. To determine, health workers uses her thumbs to press gently for a few seconds on the upper side of each foot. If a dent results in both feet, the child has edema. Edema is an important sign of kwashiorkor or a form of severe malnutrition. This child has kwashiorkor. This child has edema or swelling is due to an accumulation of fluids in the child's tissues. Next, determine weight for age using a growth chart. A child weight for age is another indicator of malnutrition. A child with very low weight is malnourished. He needs to have his feeding assessed. Check the child's immunization status. Decide whether Any immunizations are needed today, and when the child should come back to the clinic for their next immunizations. This child should go home with his immunization up to date. Finally, assess other problems the child has.